When I first started in my career, I was in public accounting, and leadership honestly wasn't part of my thinking. But after a few years, I realized that I craved the decision-making responsibility. And so I went to work for a health system as the controller. I had a wonderful mentor who told me that I needed to keep broadening my areas of responsibility and try out leadership. And he really pushed me into HFMA so that I would have a chance to become a leader and practice leadership skills in a different environment. So I'm really grateful to him. And I found out that I loved it and really then wanted to take on more and more responsibility, both for my employer but also with HFMA. In thinking back about risks, I think there were two times in my career that, in my judgment, I've made pretty serious risk-taking steps, and in both cases it turned out to be wonderful choices, but not without agony in doing it. The first time was when the CEO of the health system where I was the CFO left, and I had to make up my mind whether I was going to apply for the position. And I think if I could say anything to women in particular who might be looking at this, I think a lot of times women wait to be asked to do a particular job or to take a particular responsibility. And I realized quickly that if I wanted to do it, I was going to have to raise my hand and say, please consider me. And I went through the search process and ended up being chosen. So I switched from being a CFO to being a CEO. And it was a pretty scary thing to do. I was 34 years old, and it turned out to be just a wonderful experience in every way. I had a great board, I had a wonderful management team. It really broadened my horizons in terms of understanding clinical things and operational things and not just financial. And it was a risk that I was so glad in retrospect that I took. Then that led me to the second one, which was I did that for 7 years, and I had turned 40 and decided that I needed a new challenge in my life. And so I planned very carefully and decided to jump off a cliff and quit my job and go to law school. And at age 41, that's what I chose to do. And I wasn't sure exactly what I was going to do with it. I thought it might be the biggest financial mistake I was ever going to make in giving up that job. But in retrospect, I love practicing law. I only do healthcare transactional work, so it's perfect from a background standpoint. It gave me a whole new energy to start something new at age 44. And I always tell people, don't be afraid. I mean, think about it carefully, but you can analyze it to death and then never really do what you want to do. And it wasn't easy, but it was well worth the risk. I think the most challenging thing in my career, and probably in everyone else's, is simply the demand on our time. We're available 24/7 by technology. In my case, I work for a lot of different clients and have to balance their needs, one versus the other, and I try to make everyone a priority because that's the way that they should feel. I think it's really important that you have a balance in your personal life as well, so that work doesn't become all-consuming, because it very easily can. I end up doing a lot of volunteer work because it takes me out of the workplace and into places that I otherwise wouldn't be. I just finished serving 4 years as a college board chair, and higher education was a complete eye-opener to me. So I think that's really important. And I think you have to do some things for fun. And I want my husband to feel as though we have a good marriage and we're attentive to our marriage. And I want to be healthy. The worst thing that I do is not exercise enough. But I think we have to really try to keep that balance in our lives so that we stay both emotionally and mentally charged, as well as physically interested in the job. For someone who's just getting into healthcare and is thinking about advancing in her career, I would say take every opportunity to learn as much about the breadth of the business as you can. Going back to my mentor, one of the things that he told me early on was I couldn't be a good controller of a health system if all I understood were the financials, that I had to really get out and understand the operations and understand the decisions that were being made. And he sent me to the bioethics committee as a member so that I would really understand hard choices that people were making. So I think volunteering to be on committees, learning as much as you can, having conversations with people who do a lot of different things from you, I think is one thing. Certainly the opportunity to have leadership roles in an organization like HFMA is very powerful, because employers will view your success and your willingness to take responsibility as translating to the workplace. So I think that that's helpful as well. I think the most important thing that I would say is don't be afraid to take the risk, to raise your hand and say, I'd like to try a different job, or I'd like to take on a different responsibility. Because many times it pays off in so many ways, and your responsibility is to advance yourself, and sometimes I think that that's hard for women to do, but really important if you want to be successful.